Hey everyone, VP here with Men Physical Therapy. Really excited to spend some time today with our newest therapist, Dr. Josh Davis. He is here from Denver, and we're excited to have him on. He is our new orthopedic physical therapist, and just want to spend some time just talking to Josh, learning a little bit more about him, and most of all, learning more about what he likes to treat and the specific interests that he is in. Josh, again, is from Denver. He went to CU for PT school, and he has some really cool specific interests, and I think he'll be a key member of our team and brings some interesting skills to our team that I think will be a good fit for us. So, everyone, Dr. Josh Davis. Josh, tell me a little bit about yourself, where you're from.
Thanks, VP. So I'm Dr. Josh Davis. I'm originally from Connecticut, New Englander, born and raised. I moved to Denver in 2018, where I attended the University of Colorado School of Medicine to receive my doctorate in physical therapy. And that's what eventually led me here to joining the men team.
Yeah. So Josh, you graduated from CU and you started at a clinic down in Denver, and then what drew you to us? How did you hear about us? How did you get here to practicing with us?
So I had initially found men while I was a student at CU and had been following the clinic pretty closely because I just realized the excellence that was coming out of here from all the clinicians and the content that was being put out. I was working in a high volume outpatient environment, seeing over 20 patients a day, and just did not feel I was able to provide the level of care to individuals that I got into physical therapy for. So the ability to have full hour one-on-one treatment sessions, I think, is absolutely integral to the physical therapy process and really allows an individual to make meaningful change for their patients.
Yeah, I think that's common. A lot of our clinicians here came from backgrounds just like yours, and I think there's definitely a mend difference when you start establishing the model of the one-on-one for an hour and being able to be a good problem solver in that time. So tell me a little bit more about like your interests. Like you definitely have some interests outside the clinic in terms of the type of population that you like to treat, or in terms of your niche with our clinic. What would that be?
So as VP well knows, I have a pretty substantial fitness background prior to physical therapy. So I used to own a CrossFit gym in Connecticut before moving out here to Denver. So I love working with athletes. I'm passionate about gymnastics and soccer personally outside of just that fitness realm. But I feel those individuals, especially people struggling with knee pain, shoulder pain, and ankle conditions, is really where I feel like I hit my stride well.
Yeah, that's great. And I think being in Boulder County, we see a lot of those people. Tell me, like, the spectrum of athlete, especially in Boulder County, is wide ranging, right? So we have athletes that get paid for what they do. And then we have the people who, like the majority of folks, who just love to do things on the weekends or in the evenings. Like, describe what's an athlete to you, and what do you like to treat there?
Yeah, I feel my definition of athlete is much different than what individuals might expect. People tend to hear athlete and they think that it means we need somebody who is competitive, perhaps Division I soccer player to be considered a soccer player. I view any individual who has a passion for moving their body frequently for recreation and enjoyment to be an athlete. That really comes from my fitness background and working with individuals of all ages across that spectrum to help them become the best version of themselves that they want to be.
Yeah.
That's what I truly consider to be an athlete. The elite individual, they are who they are and they are excellent, but I find the individual who just has a passion for movement and moving their body to be the type of person I consider to be an athlete and that I really want to work with.
Yeah. Josh, his unique history is of being in front of those athletes, and even before PT school, you had a chance of just observing movement and what that looks like. Owning a CrossFit gym, you saw wide ranges of movement, and you're able to, albeit not in a physical therapy realm, but you were able to appropriately prescribe appropriate movements for individuals from all different all different experiences, levels of athleticism. And so I think that's really what makes you a great asset to our team. Yeah.
Thank you. Yeah, I feel it's a very important skill for physical therapists, as a profession who prides ourselves on exercise and movement as medicine, to be able to adjust what we're doing to the level of the individual where they're at on a rehabilitation spectrum, whether that is immediately following an acute injury to appropriately activate tissue for symptom reduction, along with progressive loading and strengthening to eventually enable that return to sport, or not necessarily sport, but just ideal recreational function. And then being able to work with those individuals along that continuum of care and progress beyond rehabilitation. Physical therapy has a unique opportunity to be involved in an individual's health and well-being far beyond that rehabilitation from injury. And I think that we get boxed into that too often. We should be the provider of choice for individuals to maintain their health over the long term and the continuum of their life, rather than just be involved in an individual's care when something does happen. Because anybody who wants to move their body frequently tends to have something happen at one point or another.
Yeah, I think that's our big goal within the Boulder County area, is to be the musculoskeletal provider of choice, but throughout the continuum of care, right? So we want to be there for you when you are in the first couple days after an injury or a surgery, but we want to get you, our goal is not to get you out of pain. We're not going to restore range of motion. We want to get you back to your normal level of activity plus one, right? Plus one. If you have goals of, you've run a half marathon, you have goals of running a full marathon, we want to get you back to that. If you scale a CrossFit workout and you want to do one RX, we want to get you there. And so being that musculoskeletal provider of choice, not just in the delicate moments, of course, that's a key for us of eliminating the pain, but getting you back to that normal activity and then some. That's our goal at Mend. So thanks, Josh.
Absolutely. Thank you, VP.
Yeah. So before I let you go, how do, if people are interested in getting to know you or want to jump on your schedule or interested in seeing what you can provide for them, how can they get a hold of you? What's the best way for them to schedule?
So best way would be via the website or email. My email is josh@mendcolorado.com. We have the opportunity on the website to link to schedule directly with me. And you can also go down to the contact us, fill that out, and we will be happy to get back to you as soon as possible.
Yeah. Well, thanks, Josh. Yeah, again, we're so excited to have him on. Mend is growing, and we're so happy to have just really good, skilled therapists on our team. And I know Josh will be just a great addition to our team. So thank you.
Thank you.
Yeah.